If you have broken or missing teeth, you can replace them with dental implants.
It's really the best option, and One First Coast Dentist is using a procedure that offers the greatest precision possible. Dr. Jason Lewis for the Bartram Dental Center joins us now with details on how this really easy process works. And I know because I went through it with him firsthand. How are you?
Yes, you did. I'm doing great. How are you?
I'm very good. It's good to see you again. So let's just talk about what a dental implant actually is.
Sure. Basically, it's an artificial tooth that's made from a nickel titanium metal that basically we place in the upper or lower jaw and acts as your natural tooth. And we basically can put a crown on it, a bridge, or even use the implants for dentures as well.
So if you're missing a tooth, basically, you can put one in that'll stay there and it's permanent just like the rest of your teeth.
Yes. In fact, they're made to last a lifetime. So essentially, you lose a tooth, you replace it with a dental implant, and if you take good care of it, it should last the rest of your life.
Nice.
There's something called a surgical guided dental implant. What's that all about?
Great question. Basically, what it allows us to do is place the implant as precisely as possible. So for instance, if I asked you to draw a circle and draw on a piece of paper, and yeah, we can also see a picture, there's a picture there earlier of what the surgical guide looks like. But if I asked you to draw a circle, you could probably draw a near perfect circle almost every time. But if I asked you to take a compass and actually, as we see on the picture here, take a compass and actually draw a circle, you would draw it perfectly every time.
Right, right. So what's the difference between then a surgical guide and then eyeballing it? So did they actually used to eyeball it? They would just look and go, oh, that looks like a good spot, and put it in and be done?
We had the X-ray technology, but now we have a three-dimensional X-ray that we can take that allows us to view the implant in a 360-degree view. So we can actually see, if we're placing it as parallel and as precisely as possible.
And I experienced this firsthand. It was actually a really simple process.
Yeah, go through it. I was hearing some of it when he came back, but what in the world is this all about?
So he's taking the 3D X-ray right now. It's very similar to a panoramic X-ray. So it literally takes about 10 seconds to take the X-ray there, and you can see he's having a good time. And
I didn't feel a thing, and I had a cookie before I got on there. So
exactly. We give all our patients a cookie before they have this X-ray done.
That's good for a dentist to give away sugary treats.
Right.
That's reassuring more business.
That's exactly.
So simply, I walked in, I put the little thing on, I put my mouth on the thing, and it did a complete 3D X-ray of me, and it was 5 minutes, and then we were on to the next step, which was?
Exactly. So from there, what we do, we take some pictures of your teeth with our CEREC machine, which is basically a machine that makes crowns in the same day.
That was cute.
Yeah, he looks great there. And so basically from there, we actually can use this technology to know exactly where to put the implant, because we want to know where the crown or the bridge is going to go. So this is what I'm doing, is basically taking pictures so we know exactly where to place the implant.
And here, T, you're right. There are teeth. These are actually, not to scale, but Nick's teeth.
Yeah, I was going to say, Nick's got some pretty big teeth here, and as you can see, the middle tooth there is a dental implant. And as you can see from the gums, and I'll turn around to the other side here, you can see it looks very natural. You would never know that somebody actually had a dental implant there. So it's the closest thing you can get to a natural tooth.
And I'm sure there's no pain or anything associated once the implant is in. It's just like anything else that you would get, surgically, I guess, implanted, like a knee or whatnot.
Exactly, and healing time, is actually very quick. But yeah, it's an easy procedure to go through, and patients that have it done, they're definitely happy that they had it.
So we did the first thing, we did the 3D X-ray thing, 5 minutes. We went into the next room. You did the additional just to see exactly what was going on in there. That took another 5 minutes, 10 minutes. And then we went on to the consulting room where you sat down and we literally had the image come up immediately and we could see everything that was going on. So what happens here?
So here I'm basically, I've got the two-dimensional image, and now that's the three-dimensional skull image right there. Yes, kind of show what Nick's skull looks like.
Okay. Not a lot
in case
upstairs,
you were,
huh? Notice the top part's cut off.
my brain is not bone, it's only looking at bones.
So that was the dental implant there that I was selecting. I can select any dental implant that's actually manufactured, and I can literally place that implant into the area where you're missing the tooth, and then I can have the surgical guide made to pretty much copy exactly how I designed it on the computer.
And the crazy thing is you can do this whole process and be fitted and have everything ready to go in like an hour, hour and a half, and be out of there. You get a temporary one, they make the real one, you come back, you put it in, it's done.
Exactly. It takes
It's a really simple process.
Takes a few months to heal from the implant. The implant procedure itself takes about an hour. But yeah, coming in for the X-ray and everything only takes about 30 minutes, so it's pretty quick.
Good stuff.
Well, thank you. We appreciate you being here once again, Dr. Lewis from Bartram Dental Center, and then we want to thank them, of course, for sponsoring this segment.
If you have any questions about the surgical guide dental implant procedure or any other issues, you can reach Dr. Lewis and his staff on their website at bartramdentalcenter.com or call 201-6000.